Benefits of ABA therapy. ABA therapy doesn't treat autism, but it can be used to teach desirable behaviors and to reduce or extinguish undesirable ones. For example, ABA may be used in autism to reduce tantrums, teaches a child to sit quietly or use words to make requests. It can also be used to reward a child for simple and complex skills, like brushing their teeth correctly or sharing a toy with a friend. Some ways that ABA therapy can impact an individual's life include acquiring and practicing social skills, decreasing problem behaviors, developing memory and cognitive abilities, improving emotional connections with other people, improving language and communication skills, improving attention and focus, learning daily living skills, managing feelings of aggression and anxiety, effectiveness. ABA therapy has become a widely used treatment approach in the treatment of autism and other conditions. It has been linked to improvements in key areas including language, social skills, and adaptive skills. One study found that long term comprehensive ABA treatment could help autistic children improve their daily living skills, language development, social abilities, and intellectual functioning. A 2011 review of 27 studies found that ABA interventions were effective for improving social skills, adaptive behaviors, language abilities, and cognitive skills. These interventions were also helpful for reducing aggression and anxiety in children and adolescents. A 2012 study suggested that children with autism spectrum disorder should have access to a minimum of 25 hours per week of comprehensive ABA therapy, which has been linked to improvements in play skills, behaviors, language, and social communication. How those results translate to long term benefits throughout life is still being examined. It's also important to note that ABA therapy doesn't treat autism but rather aims to achieve specific outcomes such as the modification of certain behaviors associated with autism. Things to consider. ABA is not the only approach to treatment, so it's important to listen and look at how a person is responding in order to determine which treatment is right for their need. While ABA is widely used today, it's not without controversy. In the past, this type of treatment involved hours of treatment each day, often done in rigid environments. Failures to produce desired behaviors were often addressed with harsh punishments, which were considered both disrespectful to those in therapies and often dehumanizing. Most recent approaches focus on either applying or withholding reinforcement and do not involve punishments, rather than sitting at a desk doing discrete trials for hours each day. Treatment is now often delivered in natural settings, including the home, school, and community settings. ABA therapy is often focused on getting people to engage in typical behaviors. Today, there is a greater appreciation and value for neurodiversity. Rather than trying to force people to fit a specific mold, newer approaches are instead focused on helping people develop and strengthen the skills that will allow them to reach their potential and live a fulfilling life. How to get started? If you are ready to try ABA therapy for yourself or your child, there are some steps that you can take to help find the best treatment for your needs. Get a referral. Talk to your doctor or child's pediatrician for a referral to an ABA provider. You can also search online for local service providers. Check with your insurance. ABA therapy is often covered by insurance, so check with your policy provider about coverage and contact your therapy provider to be sure that they take your insurance. Find the right therapist. Start by checking that your therapist is a board-certified behavioral analyst. Early ABS sessions often focus on building a rapport with a therapist, so pay attention to whether it seems like a good match. As with other types of therapy, it can be helpful to give it a try and keep an eye on how things go. If you notice good outcomes over time, it may be a good idea to stick with it over the longer term. If you or your child struggles with treatment or does not achieve good progress over time, it may be a good idea to switch to a different treatment approach.